Vaginal dryness can be surprisingly painful. It can make simple things like sitting, walking, or even exercising feel uncomfortable. Some women even notice burning or pain during urination or intimacy. And while many assume it's just part of getting older, that's not entirely true. In this video, I'll explain what really causes vaginal dryness and the treatments that can actually make you feel comfortable again. I'm Dr. Eliza Hart, a board-certified obstetrician and gynecologist with over 15 years of experience in women's health and hormonal wellness. Over the years, I've met countless women who came into my clinic worried, confused, or even embarrassed about vaginal dryness, many of them thinking it was something they simply had to live with. But the truth is, this condition isn't just a normal part of aging. It's a biological response to changes in your hormones, particularly the steady decline of estrogen after menopause. In today's video, we'll break down the real medical reasons behind vaginal dryness and explore the most effective treatments that can help you restore comfort and confidence again. If you find this topic helpful, please subscribe and comment below with the country you're watching from. Let's see how far this message of women's health can reach around the world. And please help me reach my first 20,000 subscribers so I can continue creating more science-based guidance for you. Now let's begin by understanding why vaginal dryness happens in the first place. 1. The hormonal connection. When estrogen fades. When women reach their 50s, something subtle yet profound begins to shift inside their bodies. The ovaries, which once released estrogen in a steady rhythm, begin to slow down. This decline is silent at first, almost invisible, until one day you notice that comfort in your most intimate area is no longer what it used to be. The tissue feels thinner, drier, and occasionally even sore to the touch. It's not your imagination, and it's not simply age catching up. It's the biological impact of losing one of your body's most protective hormones, estrogen. Estrogen is not only about fertility, it is the quiet architect of vaginal health. It maintains the lining's thickness, elasticity, and natural lubrication by supporting microcirculation in the vaginal wall. When estrogen levels fall after menopause, these blood vessels constrict, reducing the oxygen and moisture that once kept the tissue supple. As lubrication decreases, friction increases, and even everyday movements, sitting, walking, exercising, or intimacy can start to cause pain or burning sensations that feel entirely new. From a medical standpoint, this isn't degeneration, it's adaptation. The vaginal tissue is responding to a new hormonal environment. Without enough estrogen, the cells that once held moisture and secreted natural fluids lose vitality. Doctors call this vaginal atrophy or genitourinary syndrome of menopause, a condition that quietly affects more than half of all postmenopausal women. Yet most suffer in silence, assuming nothing can be done. But medicine tells a different story. With the right support, such as localized estrogen therapy or lifestyle changes that stimulate blood flow, the tissue can regain much of its former strength and comfort. Restoration is possible because the body remains responsive to care at every age. Vaginal dryness is not a failure of femininity. It is a signal, a gentle reminder that the body needs nourishment adapted to its new phase of life. What's remarkable is how quickly women begin to feel improvement once estrogen balance is restored. Increased moisture, reduced irritation, and a renewed sense of ease are often noticed within weeks. It's a testament to how resilient the female body truly is, always capable of healing when given the right attention. Recognizing this connection between hormones and comfort is the first step toward healing. Once you understand the language your body is speaking, it becomes easier to listen, respond, and restore balance. And with that foundation, we can now explore other surprising causes that make dryness worse, even in women who are not yet fully menopausal. 2. Beyond menopause, other causes you didn't expect. While menopause is the most common cause of vaginal dryness, it's far from the only one. Many women are surprised to learn that dryness can appear at other points in life, even in their 30s or 40s when hormones temporarily fluctuate or when lifestyle factors interfere with the body's natural lubrication. Understanding these lesser-known triggers helps you see dryness not as a single event tied to menopause, but as a broader reflection of how delicate and responsive the vaginal environment truly is. One of the most overlooked causes is the period following childbirth or during breastfeeding. During this time, estrogen levels remain low as the body prioritizes prolactin for milk production. The result is a hormonal landscape similar to menopause, thinner, drier vaginal tissue that may cause irritation or discomfort during intimacy. This usually improves once hormone levels stabilize, but for some women, the sensation of dryness lingers longer, requiring gentle medical or topical support to restore balance. Medications are another major contributor. Drugs that are designed to help other parts of the body can unintentionally dry the vaginal tissue. Antihistamines, for example, are formulated to reduce mucus production throughout the body, and that includes the vagina. Acne medications such as isotretinoin, widely recognized by the brand name Accutane, decrease oil production in the skin, but can also reduce natural lubrication. Certain antidepressants, which influence serotonin and norepinephrine levels, may alter arousal response and moisture as a side effect. Even oral contraceptives, particularly low estrogen formulas, can lower circulating estrogen enough to cause persistent dryness. Smoking compounds the problem by constricting blood vessels and impairing the microcirculation that nourishes vaginal tissue. The same chemical processes that age the skin on your face affect the lining of the vagina, reducing oxygen, slowing healing, and diminishing lubrication. Over time, smoking accelerates the decline in elasticity, making dryness more pronounced and more difficult to reverse. And then there are personal care habits that seem harmless, but quietly disrupt the body's natural chemistry. Douching scented soaps and fragranced wipes can strip away the protective pH balance and beneficial bacteria that keep the vaginal ecosystem healthy. The result is irritation sensitivity and increased dryness that often worsens with continued use. Recognizing these triggers doesn't mean blaming yourself, it means gaining awareness. Once you identify what's contributing to dryness, you can make small, meaningful changes, discussing medication adjustments with your doctor, choosing fragrance-free products, or simply giving your body time to recalibrate. Knowledge allows you to move from discomfort to control, and that control is empowering. In the next part, we'll look at how certain medical conditions often hidden beneath the surface can quietly intensify dryness and discomfort, even when hormones or lifestyle seem balanced. 3. Medical conditions that make it worse. Not every case of vaginal dryness is purely hormonal. Sometimes the body is responding to deeper medical conditions that quietly influence moisture levels and tissue health. These underlying issues often go unnoticed, yet they can significantly worsen dryness, even in women who maintain balanced lifestyles or mild hormonal support. Understanding these hidden connections allows you to approach treatment not just symptomatically, but holistically, addressing what your body might be trying to tell you. One of the most common examples is diabetes. When blood sugar remains elevated for long periods, it disrupts circulation and damages small blood vessels throughout the body, including those that nourish the vaginal lining. The result is reduced blood flow, diminished natural lubrication, and slower healing after irritation. Women with diabetes also face a higher risk of infections, which can further aggravate dryness and discomfort. Good glycemic control not only protects your overall health, but directly supports vaginal wellness as well. Another condition is Sjögren's syndrome, an autoimmune disorder in which the body mistakenly attacks its own moisture-producing glands. Most people associate it with dry eyes and dry mouth, but for women it often includes vaginal dryness too. This type of dryness can feel more persistent because it isn't solely tied to estrogen loss. It's the immune system itself interfering with lubrication. Treatments may involve specialized moisturizers, local estrogen therapy, or medications that help restore glandular function. Cancer treatments are another major cause that many women overlook. Chemotherapy, radiation, and certain hormonal therapies, especially those used in breast or ovarian cancer, can sharply reduce estrogen levels and affect the balance of vaginal tissue. Women who have undergone these treatments often describe a sudden change in comfort. In these cases, support must be personalized, focusing on safe, non-hormonal options approved by the treating oncologist. Even surgical removal of the ovaries, known as oophorectomy, can lead to abrupt dryness and discomfort, as the primary source of estrogen is removed overnight. This kind of change can be emotionally challenging because the body doesn't have time to adapt gradually. Restoring comfort requires patience, gentle care, and medical guidance to rebuild confidence and ease. If any of these situations feel familiar, you are not alone. Many women find that talking about their experiences helps others feel less isolated. So before we move forward, I'd love to hear from you. Have you ever dealt with dryness linked to a medical condition or treatment? Share your story or simply type yes or no in the comments. Your openness might give another woman the courage to ask her doctor for help. As we continue, let's look beyond conditions and see how the choices we make every day, from products to routines, can either soothe or worsen this delicate balance. 4. Doctor-approved solutions that actually work. Once the cause of vaginal dryness is identified, the next step is finding the right treatment, one that respects your body's biology and restores natural comfort rather than masking the problem. As a physician, I've seen countless women regain ease and confidence once they understand that dryness can be treated safely and effectively, often with simple evidence-based approaches. The goal is not only to relieve symptoms, but to help the vaginal tissue rebuild its natural strength, elasticity, and moisture over time. The cornerstone of treatment for many women is local estrogen therapy. This comes in the form of creams, rings, or tablets applied directly to the vagina. Unlike systemic hormone replacement, these options work locally, delivering just enough estrogen to nourish the cells and restore moisture without significantly affecting the rest of the body. Over several weeks, the tissue becomes thicker, blood flow improves, and natural lubrication often returns. It's one of the most effective medical treatments we have, and for many postmenopausal women, it feels like getting a part of themselves back. However, not everyone is a candidate for hormonal therapy. Women with certain cancers, clotting disorders, or other contraindications may benefit instead from non-hormonal options. These include vaginal moisturizers that mimic the body's natural secretions and provide continuous hydration, as well as lubricants used before intimacy to reduce friction and irritation. When choosing a product, it's essential to read labels carefully. Water-based or silicone-based formulas are generally the safest. Avoid glycerin, alcohol, or fragrance, as these can worsen dryness or cause burning. In addition to medical treatments supporting circulation through gentle movement, pelvic floor exercises, and deep breathing helps oxygenate the tissue, encouraging natural repair. Even small habits, such as staying hydrated and consuming healthy fats like omega-3s, contribute to maintaining lubrication. The body's tissues respond best when they're cared for from the inside out. Restoring vaginal health is not about reversing time. It's about working with your body's new rhythm. It may take several weeks to feel noticeable improvement, but consistency matters. With the right therapy, most women experience not only physical relief, but also emotional reassurance that their comfort and femininity are fully restorable. As we move forward, let's explore how daily choices, from hygiene routines to diet, can either help or hinder that healing process, ensuring the results of treatment last for the long term. 5. Lifestyle triggers you can control. Medical treatments can bring remarkable relief, but long-term comfort depends on how you care for your body each day. Many women underestimate how powerfully small habits, the things we do without thinking, can either support or sabotage vaginal health. Recognizing and adjusting these triggers is one of the simplest yet most transformative ways to maintain lasting balance. The first habit to consider is smoking. Beyond its well-known effects on the heart and lungs, smoking directly impairs blood flow throughout the body. The same restricted circulation that causes premature wrinkles also limits the oxygen and nutrients reaching the vaginal tissue. Without proper blood supply, the delicate lining becomes thinner, drier, and less able to recover from friction or minor irritation. Quitting may seem daunting, but it remains one of the most effective ways to restore both skin and vaginal vitality regardless of age. Hydration plays an equally vital role. The vagina, like every organ, depends on adequate fluid intake to maintain elasticity and lubrication. When the body is dehydrated, moisture is diverted toward essential systems such as the heart and brain, leaving mucous membranes, including the vaginal wall, deprived. Drinking water regularly, limiting caffeine, and incorporating water-rich foods like cucumbers or oranges can subtly yet significantly improve comfort over time. Nutrition also shapes how well the body protects and repairs its tissues. Diets rich in omega-3 fatty acids from salmon, flaxseed, or walnuts help keep cellular membranes flexible and well lubricated. Vitamin E supports tissue healing, while magnesium and zinc contribute to hormonal balance and muscle relaxation. Many women also find that reducing sugar and processed foods lessens inflammation, which otherwise disrupts the natural pH and microbiome balance of the vagina. Daily hygiene habits deserve the same attention. Using harsh soaps, bubble baths, or fragranced wipes can strip the vaginal tissue of its protective oils and beneficial bacteria. Gentle pH balance cleansers or simply warm water are sufficient for keeping the area clean without disturbing its natural defenses. Choosing breathable cotton underwear and avoiding prolonged moisture after bathing also helps maintain a healthy environment. It's worth remembering that caring for your vaginal health is not separate from caring for your overall wellness. Every glass of water, every mindful meal, and every small act of self-care supports this intimate balance. Once these foundations are in place, the body responds with quiet strength, less dryness, more resilience, and a renewed sense of ease that feels both physical and emotional. And with the groundwork of daily care established, we can now turn to the final and often overlooked piece of the puzzle, the emotional aspect of healing, and how understanding your body can restore confidence from within. 6. Emotional aspect. You're not broken. For many women, the most painful part of vaginal dryness isn't always the physical discomfort. It's the quiet emotional weight that comes with it. The sudden loss of ease in one's own body can feel confusing, even isolating. Some begin to wonder whether something about their femininity, their desirability, or their vitality has changed forever. Yet from a medical and human perspective, this stage of life is not an ending. It is a transformation that simply requires new understanding and care. Emotions and hormones are deeply intertwined. When estrogen levels drop the brain's production of serotonin and oxytocin, the chemicals that promote connection, calm, and pleasure also declines. This is why vaginal dryness can feel more than physical. It often carries emotional echoes of frustration, sadness, or self-consciousness. As a physician, I've seen how addressing these feelings with compassion can be as healing as any prescription. Once a woman realizes she isn't alone, that countless others share her experience, she begins to move from embarrassment to empowerment. Talking openly with your healthcare provider or even with a trusted friend can be liberating. These conversations replace shame with knowledge and fear with choice. Many women find that when they understand the biological reasons behind their symptoms, the sense of guilt or inadequacy dissolves. What remains is clarity, and with clarity comes the ability to take control of one's health again. Equally important is reconnecting with your body in gentle, non-judgmental ways. This might mean taking a few quiet minutes each day to breathe deeply, relax your pelvic muscles, or simply acknowledge the resilience of your body. The goal isn't to chase youth, but to build harmony with where you are now. Every act of care, from using a moisturizer to practicing mindfulness, tells your body that it's still worthy of attention, comfort, and joy. When women begin to view this phase as a continuation rather than a loss, something powerful happens. They rediscover confidence, ease, and even pleasure, not because they have turned back time, but because they've learned to work with their bodies rather than against them. It's a moment of realization that aging does not take away womanhood. It deepens it, grounding it in wisdom and acceptance. Now that we've understood both the science and emotion behind these changes, it's time to bring everything together into a simple, gentle daily routine designed to help your body heal and stay balanced with consistency and kindness. Now that both the science and the emotional side of vaginal dryness are clear, the next step is to bring them together through calm, consistent care. Healing doesn't happen overnight. It comes from small, intentional actions that tell your body it's safe to repair and receive nourishment again. A gentle daily routine allows you to work with your body's rhythm instead of fighting against it, gradually restoring comfort and confidence. Start with the simplest foundation: water and awareness. Hydration supports every cell in the body, including those in the vaginal wall. When you drink enough water throughout the day, natural lubrication improves and tissues regain elasticity. Paying attention to how your body responds when dryness feels worse or when relief appears helps you reconnect with your physical rhythm and understand what it needs. Nutrition also plays a vital role. Foods rich in omega-3 fatty acids such as salmon, walnuts, and flaxseed help maintain the flexibility of cell membranes, while vitamin E assists in tissue repair. Incorporating these nutrients regularly strengthens both the skin and the mucous membranes, supporting your body's natural moisture balance. Gentle pelvic floor exercises, walking or slow yoga stretches further enhance circulation to the pelvic area, improving oxygen flow and helping tissues stay supple. In the evening, take a few minutes for quiet care. Applying a pH-balanced vaginal moisturizer several times a week, particularly before bed, can provide lasting hydration through the night. Combine this with deep breathing or light relaxation before sleep. These moments of stillness help regulate your stress response and allow hormones to function more efficiently. Avoid scented soaps or harsh cleansers that can disrupt the delicate microbiome. Warm water and mild, unscented products are usually enough. Consistency is what makes these small steps powerful. Over the course of a few weeks, many women notice reduced irritation, improved softness, and a renewed sense of ease that extends beyond the physical. Each mindful act, drinking water, eating well, breathing slowly, is a quiet affirmation that your comfort still matters. And even when progress feels subtle, remember that small improvements add up, reshaping the way your body feels, functions, and responds over time. Those quiet shifts may not seem dramatic, but they accumulate into steady, lasting transformation. Through these gentle practices, you are not just addressing dryness, you are rebuilding trust with your body. And as that connection deepens, the sense of control and confidence that follows becomes one of the most profound forms of healing. Vaginal dryness is not simply a symptom of aging, it's a message from your body, a reminder that change requires understanding and care. Throughout this video, we've explored how declining estrogen, certain medical conditions, and everyday habits can quietly reshape comfort in a woman's life. Yet what's even more important to remember is that every part of this process is reversible. With the right medical guidance, consistent daily habits, and patience, your body can regain its natural balance and vitality. The key is to approach your health with curiosity rather than frustration. If you've been struggling with dryness, don't ignore it or accept it as something inevitable. Talk to your doctor, ask questions, and learn what treatments best fit your situation, whether it's hormonal therapy, non-hormonal moisturizers, or simple lifestyle changes. Your comfort is not a luxury, it's a reflection of your body's inner harmony, and you have every right to reclaim it. Remember that healing takes time. Every glass of water, every moment of relaxation, every mindful choice brings you closer to comfort and confidence. Treat these small acts not as chores, but as quiet affirmations of self-respect. Your body listens to consistency, not perfection. I'm Dr. Eliza Hart, and I hope today's video helped you understand that vaginal dryness is not a sign of loss. It's an invitation to care more deeply for yourself. Thank you for spending your time here and for being part of this growing community of women who choose knowledge and healing over silence. If this video brought you clarity or comfort, please subscribe, leave a comment sharing your thoughts, and tell me which country you're watching from. I love seeing how far this message reaches. Together, we can continue to build awareness and empowerment for women everywhere.